Have you ever wondered, in spite of so many drug classification, there is another classification that is called as BCS classification. BCS Classification of Drugs. BCS is a system that classifies drugs into 4 different classes based on their solubility and permeability characteristics. Hello everyone, welcome back to my channel Pharma Talk with Imran. In today's video, we are going to see the BCS classification of the drugs, that is Biopharmaceutics Classification of the Drugs. Here we are going to study how the drugs are classified into different classes. Now, what is the importance of BCS classification or Biopharmaceutics classification? So, it mainly helps in predicting the parameters like solubility of the drug, permeability of the drug in the body, and bioavailability. Then, it also helps in formulation development, like selection of suitable excipients, then enhancing the solubility techniques, then drug stability, improving the drug stability. Then, it also helps in selection of suitable dosage form, whether we are going to produce a immediate release dosage forms, modified release dosage forms, oral and other dosage forms. Then it also helps in granting the biowaiver statement or study. Here waivers of in vivo studies means biowaiver means approval of the drug without human trials, means here we are not going to administer the drug on human volunteers. Without administering the drug to the human volunteers, we are getting the approval by the previous data. So let us consider a simple example. For example, we are going to see a drug paracetamol. So suppose a company wants to create a generic product of paracetamol drug. So it is going to produce so many tablets of paracetamol. Then this company is going to conduct the dissolution test. And the report or the data which is obtained by the dissolution test is approved by the regulatory authorities. Based on because it is already an established drug and it is available in the market, so that the regulatory authorities will easily give the acceptance or approval without the human trials. So this kind of approval is called as skipping the biowaiver study, or you can say the skipping the human trials or administration of the drug on the human body, and their investigation is easily skipped by the company. So it is also, the BCS classification is also helps in this way. BCS classification is based on mainly 2 properties. The first one is drug solubility. A drug is said to be highly soluble on 2 conditions. That is, when the highest single dose dissolves in 250 ml, more than 250 ml or equal to 250 ml of aqueous medium, tested over a pH 1.0 to 6.8 and a temperature of body temperature like 31 plus or minus 1 degree centigrade. So, for example, paracetamol drug is called as highest soluble drug because it is going to dissolve in 250 ml of a aqueous medium in a highest dose. The highest dose of the paracetamol is 650 mg. That is going to dissolve in aqueous medium at a 250 ml, more than 250 ml or equal to 250 ml at a pH range of 1.0 to 6.8 at a body temperature that is 37 plus or minus 1 degree centigrade. Then it is going to fulfill the criteria of solubility. Then this drug, paracetamol drug, is categorized in class 1. The second criteria is drug permeability. A drug is said to be highly permeable when it is going to fulfill this condition, that is more than or equal to 85 to 90% of the drug which is administered, means in the 100% of the drug which is administered in the body, up to 85% or 90% it is going to absorb in the human body, then it is called as highly permeable drug. So it is analyzed by human studies and in vivo animal studies. The second, BCS Class I. The drugs which are coming under this category is highly soluble and highly permeable. So what are the different characteristics? Here the drug dissolves rapidly, easily permeates intestinal membrane, means it will cross biological membranes very easily. Then there is an excellent oral bioavailability. Then what is the rate limiting step in this class? Here if there is no proper gastric emptying in the patient, then it will be some problem in the absorption of the drug. Especially the drugs which are coming under this class is paracetamol, metoprolol, propranolol and caffeine. So formulation considerations. Here there is immediate release type of dosage forms are preferred in the formulation. Then no need of solubility enhancement because they are well soluble, well dissolved. Then regulatory aspect, easily we will get the acceptance, no need to go for the human trials because the biowaiver study is acceptable in this class because it is highly soluble and highly permeable. BCS Class II. So these drugs are having low solubility and high permeability. So they are having very poor aqueous solubility, but there is a good membrane permeability, means they will easily cross the biological membranes. Then the rate limiting step in the absorption is mainly the dissolution, because it is having very poor aqueous solubility. The drug is going to slowly dissolve. Example for this category is ibuprofen, ketoconazole, phenytoin and carbamazepine. Formulation strategies. So in the formulation we need to enhance the dissolution. For that we are going to reduce the particle size, or we can go for a solid dispersion method, or we can go for salt formation method, or we can use the surfactants to improve the solubility. BCS Class III. So these kind of drugs have high solubility but low permeability. So they are going to easily dissolve in the GI fluids. Then they are having poor intestinal permeability. Here the rate limiting step or problem with the absorption is permeability. Example for this class is cimetidine, atenolol, acyclovir and metformin. Formulation strategies. So here we need to enhance the permeability. So because we use permeability enhancers, and we need to optimize the excipients also. Then Class 4, BCS Class 4. They are having low solubility and also low permeability. There is a problem with the solubility and also the permeability, both. So they are having very low oral bioavailability. The rate limiting step or problem with the absorption is both, that is solubility as well as permeability. Example for this class is furosemide is there, then paclitaxel is there, then hydrochlorothiazide is there. So while formulating the dosage form, what is the problem means? Here there is a problem with the both, that is solubility as well as permeability. Then because of that it is not preferred, especially for the oral dosage forms. It is going to fail. That is then it is mainly prefer either parenteral or intradermal. So this table contains a total summary of the video. In the first column you can see the BCS class, solubility, permeability and other characteristics and examples for the drugs. Like Class 1, here the solubility is high, permeability is also high, but the problem with the dissolution is If there is a gastric emptying time is not proper, then there is a decreased absorption, very rare case. Then example for this category is paracetamol is there, metoprolol, propranolol and caffeine. Then class 2, here the solubility is low but permeability is good, high, and here there is a problem with the absorption because the solubility is low. And example for in the formulation we need to enhance the solubility here by using solubility enhancement techniques. Example for this category is ibuprofen, ketoconazole, diclofenac, phenytoin. Then class 3, they are having good solubility and low permeability. Here in the formulation we need some permeation enhancers in the excipients. Example for this category is atenolol, cimetidine, acyclovir. Then class 4, here the solubility is also low, permeability is also low, and the characteristics is the poor oral bioavailability and it is difficult to formulate. Especially parentals and transdermal route is preferred in this category.